Thank you.
Now, let's talk about this. Now, you are really, as long as I've known you now, you've seemingly been right on the cutting edge when it comes to people like me who have been afflicted with osteoarthritis. From mine was from way too much tennis and trashing my knees, but on the cutting edge of helping people. And you've been talking now about patient-specific resurfacing techniques. What the heck is that?
Well, I think it's the next trend that we're going to see throughout medicine, but specific to knee replacement in general. Traditionally, most implant companies only have 6 or 7 different sizes, and those sizes have to fit every single patient. But we know that patients come in all different sizes: large, small, female, male. So I think the next trend that we're seeing, and the one company that we're using is the first company to really focus on patient-specific or customized implants to actually fit the patient perfectly.
All right. Now, I understand the term patient specific. That's pretty easy. But what is resurfacing?
Well, resurfacing is just a technique where we actually just remove some diseased cartilage and just a little bit of bone to resurface the knee rather than take out large sections of the knee with the associated ligaments. So it preserves the more the kinematics of the knee, the more natural feel to the knee that patients are really desiring.
Now, when you say that, you're actually keeping most of their surface in place. You've seen my X-rays, right? So when
Yes.
you see, you got very little space here, are you talking about just replacing like the meniscus, or what, or does it go beyond that?
Well, Jim, what you're referring to is when we see that decrease in space, that space is missing the cartilage that was once there. So in a healthy knee, you're going to have preserved cartilage, and it's going to represent space on an X-ray because it doesn't show up. So what the resurfacing technique does is it replaces the diseased cartilage and just a little bit of bone with a metal implant and a polyethylene or a plastic liner.
Hmm.
And what makes this technique different is these implants are actually made to fit the patient specifically, and they are also a lot more conservative. They take a lot less bone than traditional knee replacement implants.
This doesn't sound as dramatic as a total knee replacement. How does this differ on recovery for a patient, depending on how much they need to have done?
Yeah, well, what we're seeing is the patients, first of all, have usually a more straightforward time in surgery. The implants are placed more precisely because it's all done, everything done, including the cutting guides, are specific for the patient. Patients typically have less pain. They can get up and walk the day of the surgery. Some patients are even able to go home for dinner that night. Most patients are staying overnight and home the next day.
Really? You
And
know,
usually within 2 weeks, they're off any assistive devices, and by 2 to 3 months back to any activities they want to be participating in.
that's pretty incredible because I've lived with knee pain for 20 years now and have balked at doing any kind of surgery because I've heard from people who have had total knee replacements, and they talk about the extensive rehab and how long it takes to get back on their feet and so forth. And this really changes the game a lot, doesn't it?
It does. Total knee replacement's a great operation. It's probably the most common operation I do. But at the end of the day, there is about a 15 to 20% rate of people that are somewhat dissatisfied with the surgery. So as surgeons, there's certainly room for improvement with knee surgery. And I think this is really taking it to the next level, and we're going to increase our patient satisfaction. And the patients really remark on, this feels like their own knee, because it is more their own knee.
That is pretty amazing stuff. I'll tell you that. Now, you said, let me reiterate for anybody listening. You said what? They can be. It's not total outpatient, but they can be back home the next day in some cases.
Well, sometimes it can be outpatient. In a younger patient that's fairly healthy, usually we can do the surgery in the morning. They'll be rehabbing in our gym in the afternoon, and then they could be home in time for dinner.
That is just amazing. I think I'm going to have to rethink this idea I had.
Yeah, well, it certainly was something worth looking at. I mean, osteoarthritis of the knee particularly is a epidemic proportions, and there's going to be somewhere between probably 750,000 procedures to 1 million procedures done this year.
Now, this isn't done arthroscopy, right? Arthroscopic?
No, it's not done arthroscopically, but it is a significantly smaller incision with really minimal muscle cut. We're able to get in and do this procedure with a much less invasive approach than a total knee. and that's why there's less blood loss, and patients seem to recover much better.
Dr. Gregory Martin, just amazing stuff, I'll tell you. I'm fascinated by this. Thank you so much for joining us.
Well, thanks for having me.